In this video, we will discuss schizophrenia and related disorders. We will begin by talking about psychosis. That's a state in which a person loses contact with reality in many different ways. Most commonly appears as schizophrenia. And schizophrenia, as you can see here, it's a psychotic disorder in which personal, social, and occupational functioning deteriorates as a result of unusual perceptions, odd thoughts, disturbed emotions, and motor irregularities. Before we leave this slide, I will remind you that psychosis is a state defined by a loss of contact with reality. Individuals might be experiencing an inability to perceive and respond to the environment. They may experience hallucinations, which are false sensory perceptions, and/or delusions, which are false beliefs. And psychosis may be substance-induced or caused by brain injury, but most psychoses appear in the form of schizophrenia. This is a checklist that might be used by clinicians, psychologists, psychiatrists, those in the medical fields. So, schizophrenia. Usually, the first thing to check off is the person experiencing these symptoms for 1 month, and do they display 2 or more of the following symptoms much of the time? Are they delusional? Are they experiencing hallucinations? Do they have disorganized speech? They might have very irregular motor activity, as well as a variety of negative symptoms. So the clinician has to decide that at least one of the individual symptoms must be delusions, hallucinations, or disorganized speech. So when the individual goes beyond this 1 month of intense symptomology, the individual continues to display some degree of impaired functioning for at least an additional 5 months. So as this says on our slide here, schizophrenia produces many clinical pictures. This says positive, negative, and psychomotor symptoms. So positive symptoms are an excesses, or bizarre additions to typical thoughts, emotions, or behaviors. And negative symptoms are the person shows deficits in typical thoughts, emotions, or behaviors. In regard to psychomotor symptoms, that refers to the individual experiencing slow, awkward movements, repeated grimaces, and odd gestures. So we will proceed a little bit further, talk about some of the positive symptoms coming right up. So as we said, positive symptoms, that's an excess of bizarre additions to a person's behavior. So most often found, a person is experiencing delusions. They have disorganized thinking and speech patterns. They have heightened perceptions and hallucinations. And their overall effect might be inappropriate. On the next slide, we will talk a little bit more about some of the positive symptoms. I listed these here: delusions. They might have just one, single one, or many of these. So they might have delusions of persecution, delusions of reference, delusions of grandeur, and delusions of control. So research suggests that some people may have disorganized speech or thinking long before their full pattern of schizophrenia unfolds. So in regard to positive symptoms, that's when a person has things like disorganized thinking and speech, as well as inappropriate affect. So you can see under where it says disorganized thinking and speech, the first item says loose associations or derailment. So maybe an example might be the person says, the problem is insects. My brother used to collect insects. He's now 5 foot 10 inches tall. 10 is my favorite number. I also like to dance, draw, and watch TV. So that is loose associations. On this next slide, we're going to move on to talking about more positive symptoms. So maybe the person has experienced a heightened perception and hallucinations. So this image here, this is a PET scan of the brain taken at the moment that a patient was having auditory hallucinations. It shows heightened activity in certain areas of the brain, known as the Broca's area. And that's a brain region that helps people produce speech. And they may experience, you can see here, the auditory cortex, the brain area that helps people hear sounds. On the other hand, you can see here on this image the front part of the brain, which is responsible for determining the source of sounds, was very quiet during those hallucinations. So people who are hallucinating, they seem to hear sounds produced by their own brains, but their brains cannot recognize that the sounds are actually coming from within. Now, the individual that's dealing with these issues might experience what's known as heightened perception. And a heightened perception, that just means, for example, people might feel that their senses are being flooded by sights and sounds, and that makes it impossible for them to attend to anything important. And hallucinations, that's sensory perceptions that occur in the absence of external stimuli. The most common types of hallucinations for those experiencing this disorder are auditory. The most common are auditory in nature, and they feel that the sounds that they are hearing inside their minds, that is individuals speaking directly to them. Hence, that is an auditory hallucination. But want to keep in mind, though, that hallucinations can involve any of the other senses, like their tactile, somatic, their visual, their gustatory, or olfactory senses. So moving forward, we will move on to talking about negative symptoms. So some of the negative symptoms might be pathological deficits, a poverty of speech, which means a reduction of the quantity of speech or the speech content. They might also say quite a bit, but there's very little meaning to their words, to their communications. And below that, you see where it says restricted affect. That's when a person shows less emotions than most people. They avoid eye contact, and they have a very blunt, expressionless face, which is called a flat affect. Let's go further by talking about negative symptoms. Another symptom might be a loss of volition or motivation. The person feels drained. They have the inability to start or follow through on a course of action. They might have convicted feelings or a sense of ambivalence about most things. They might engage in social withdrawal, which is illogical and confused ideas. And their withdrawal from social environments and attention only to their own ideas and fantasies. And that withdrawal leads to social skill breakdown, including the ability to accurately recognize the needs and emotions of others. So some of the psychomotor symptoms, that refers to the person might be exhibiting awkward movements, repeated grimaces, and other odd gestures. And they feel that their movements might seem to have a magical quality. And those symptoms may take extreme forms. And those extreme forms are called catatonia. That includes stupor, rigidity, posturing, and excitement. Going just a little bit further, talking about the clinical picture of schizophrenia. The course of schizophrenia, usually the first appears between late teens and mid-30s. And there are 3 phases here, which is called the prodromal. That's the beginning phase, beginning of their deterioration, mild symptoms. The second phase is what's called active, and that's when their symptoms become apparent. And the residual phase is when they return to prodromal-like levels. So statistically speaking, 1/4 of patients fully recover from schizophrenia, but 3/4 continue to have residual problems. So each of these phases that we've been discussing might last for days or years, A fuller recovery from the disorder is more likely in people with good pre-morbid functioning, with people whose disorder was triggered by stress, or if they experienced an abrupt onset, or those who experience a later onset during middle age. What's important now, though, is they receive early treatment. What's important to keep in mind is relapses. They are more likely during times of life stress. And this concludes our clinical picture of schizophrenia. Now let's move on to diagnosing schizophrenia. So this manual right here is called the DSM-5-TR. That is the manual that psychologists, psychiatrists, and those in the medical fields look at in order to help them diagnose certain forms. So the DSM-5 says symptoms of schizophrenia continue for at least 6 months or more, and that those people might have active symptoms for at least one of those months and show a deterioration from previous levels of functioning. There are other schizophrenia-like disorders in the DSM-5, and those are called schizophrenia spectrum disorders. So in diagnosing schizophrenia, many researchers believe that a distinction between type 1 and type 2 schizophrenia is very important and helps predict the course of the disorder. So type 1 schizophrenia is dominated by positive symptoms. So those individuals, they seem to have better adjustment prior to the disorder, but later onset of symptoms and greater likelihood of improvement, though. And that might be linked to biochemical irregularities in their brains. Type 2 schizophrenia, as you can see, is dominated by negative symptoms. They may be tied largely to structural irregularities in their brain. I've included this chart for those of you who want more insight. Please feel free to pause the slide and gather the information that you are seeking. Here we will seek to answer the question, how do theorists explain schizophrenia? They look at this from the biological perspective. They say, well, due to genetic inheritance and brain activity, they play key roles in the development of schizophrenia. So some of those genetic factors might be people that are related to each other might experience that. There might be twins with schizophrenia, people with schizophrenia who are adopted, or direct genetic linkage research and molecular biology. That's how this all overlaps. So as you can see on this right here, after genetic factors, it says diathesis stress perspective. So diathesis stress approach, that's where genetic researchers believe that some people inherit the biological predisposition to schizophrenia. So this disposition is triggered by later exposure to extreme stress And this theory has been supported by many different studies. I mentioned previously genetic inheritance, so there might be family links. People who are biologically related to someone with schizophrenia have a heightened risk of developing the disorder during their lifetimes. The closer the biological relationship, that is, the more similar their genetic makeup is, the greater the risk of developing the disorder. Moving on, we will begin talking about the biological views in regard to biochemical irregularities. So there are neurotransmitters known as dopamine, and so certain neurons using dopamine, they become very hyperactive. They fire too often, and they help produce symptoms of schizophrenia. And there are certain antipsychotic drugs and medications that serve to help individuals who are experiencing that. Going just a bit further in regard to biological views, there are some researchers have found that dysfunctional brain structures and circuitry might be responsible for the schizophrenia. So a dysfunctional brain circuit, including the prefrontal cortex, the hippocampus, the amygdala, thalamus, striatum, and the substantia nigra, those are the various structures that are involved in this circuit. Going forward, in regard to biological views, it's been found that certain viruses, exposure to certain viruses before birth, might trigger an immune response that interrupts brain development, and that might be responsible for susceptibility for schizophrenia later in life. On the previous slide, we did talk about dysfunctional brain structures and circuits. So the brain structures, they function and interconnect in different ways, problematic ways that are collectively unique to this disorder. As you can see, newer research suggests the schizophrenia-related circuit may be two distinct subcircuits whose various structures sometimes overlap. So irregular neurotransmitter activity is now considered to be an important part of a broader circuit dysfunction that can propel people toward schizophrenia. Here are some images of the brain circuit. So the images on the right-hand side, the illustration on the right, highlights how the structures of this circuit, they typically trigger each other into action, and interconnectivity that is flawed in people with schizophrenia. And this image shows the interactivity between the immune system, how that affects the brain, as well as how one might experience schizophrenic activity. So there have been explanations that point to viral infections and immune system reactions. Researchers have found, though, that certain microglia are especially active in the brains of people with schizophrenia. So microglia are brain immune cells that provide a first line of defense against brain infections and inflammation. So these right here, these are various PET scans on the slide right here. PET, remember that's positron emission technology. So these PET scans show that the microglia activity, which is the orange sections here, they are at risk for schizophrenia. The microglia activity of participants with schizophrenia is higher than average. In attempting to explain schizophrenia, certain theorists have said there is a cognitive behavioral explanation. So when the individual misinterprets unusual sensations, things like that, there has been circumstantial support for this. So developmental psychopathologists, they say that schizophrenia typically begins to unfold long before the actual onset of the disorder in their young adulthood. And the early problems, they result largely from an inherited predisposition, but may also be due to repeated childhood stress experiences, family dysfunction, and or difficult social interactions. So a key way that the dysfunctional brain circuit may adversely affect the functioning of people who are later diagnosed with schizophrenia is through the circuit's impact on the operation of what's called the HPA axis. Remember, that is the hypothalamic pituitary adrenal stress pathway. An overactive HPA stress pathway and chronic stress lead to the development of a dysfunctional immune system, which is characterized by heightened inflammation throughout the brain. So as a reminder, development psychopathologists, they have said that the diathesis stress process in schizophrenia that typically begins to unfold long before the actual onset of the disorder in young adulthood. So early problems result largely from an inherited predisposition. But it might also be due to repeated childhood stress, family dysfunction, and or difficult social interactions. And before I conclude this discussion, I just want to remind you, though, that an overreactive HPA stress pathway and chronic stress reactions, they lead to the development of a dysfunctional immune system characterized by heightened inflammation throughout the brain, which is responsible for schizophrenia. This concludes our discussion. Thank you for joining us. Best wishes.